Hello, everybody. Thank you for joining us here at the Ridgeview POD this morning. My name is Brennen Morrow, and I'm joined by Michael Yates, where we talk about everything hope, healing, and recovery. I hope that came out okay.
Nice. It sounded beautiful. I love just being able to sit back and enjoy this conversation.
I am not anxious about this at all. So, we're going to be talking about burnout. Burnout across healthcare, within healthcare workers, and maybe touching on specifically what that's like with mental health care workers. So what does burnout mean to you?
Man, what a heavy topic, and timely as well. I mean, it is, even you and I earlier this week, we were talking about where you are in the semester coming to an end, and even you had this this sort of heavy sigh of, man, this is a topic I need to talk about. Yeah. And I think it's a topic that not only needs to be talked about just because it's an issue, but it's almost like it's a check-in, like you periodically need to be talking about it. Not just a one-time thing. So what does it mean to me? And it's a great question, because burnout sometimes gets interwoven with things like vicarious trauma, secondary stress, stress itself. Sometimes these words get tangled and interwoven with each other. But burnout to me means, as the word implies, I'm just tired, I'm exhausted, that my wheels have been turning faster than I'm able to move forward. I personally am doing a burnout. And what we know, there's a lot of evidence of what happens to people when they are in that state for too long. It compromises their immunity, it compromises their energy levels, it can affect their sleep, it can affect their overall outlook towards the outside world, and it certainly can impact your own self-concept about what you're capable of. So it's a huge issue.
Yeah, something that it's a conversation that I've been having a lot more recently, especially because I'm nearing graduation, 22 years old. All I've known is academics, really. And I had a conversation with my field instructor earlier this week on Wednesday, and we were talking about that and talking about how the state has this action plan for addressing worker shortages across healthcare, especially in mental health care. And you're also just coming off the heels of COVID. I know everyone's sick about talking about it, but that rocked healthcare.
Yep.
Not just patient care, but from the professional side of things, from the worker side of things.
Yes.
You see, I printed out this article about work overload and burnout and everything, and it's these high rates of burnout and intentional leave are across all these industries, not just mental health care, but really prevalent in nurses especially. Most of the highest rates in all these categories were among nurses and physicians, psychiatrists.
And when there's a shortage of those folks because they've left the field, who's picking up the coverage, especially in those 24/7 types of healthcare settings?
Yeah. People
end up doing double shifts, coverage shifts. They don't get the breaks that they need, so it just compounds the problem.
Yeah, it's not sustainable at all. And I wanted to touch on something real quick, and because the World Health Organization defines burnout as an occupational phenomenon that is conceptualized as resulting from chronic workplace stress that has not been successfully managed. So I thought that was a really succinct way of putting that. Because it's also they make a note of saying it's not a medical or mental health diagnosis. it's not in that official capacity, but it does have really drastic effects on a person.
Yes.
Even outside of healthcare, burnout, you see it everywhere. Maybe education, for example. So, when you have the shortage, and Tennessee's not the only state, country, whatever. Like, there's so many communities facing this problem. So I wonder how we can better address burnout, because something in my BSSW program is a lot about self-care and checking yourself and watching the burnout, because even though we are just entering the field, we are burnt out from an academic perspective. A lot of us, I won't say everyone, but
what a great, I think some of the things that we can do are this very thing right now. We're talking about it, which is a good thing. There's that, every time you get on the plane, you're always told, you go through that safety thing of, if there's an emergency, make sure you put your mask on first before tending to your child's mask or your loved one's mask. That message is pretty clear and intentional. You got to take care of yourself if you're going to take care of other people. It's that important. We walk around nowadays, these devices that are on our wrists, when you wake up in the morning, they'll tell you what kind of sleep you had. You had a restless sleep. Your score is a 46 out of 100. You need to have a better night's sleep and don't do too much today so you can recover. What would constant burnout checks be like in our own industry? And one of the cool things I think Ridgeview has done is, and it was born out of that pandemic period, we have institutionalized throughout the agency a debrief opportunity for folks. So our Lisa Winkle, who's a licensed therapist here on staff, she hosts a debriefing lunchtime check-in. Anyone can join geographically throughout our footprint. Any employees can join. And it's just an opportunity to share with one another what's going on. It could be professional, it could be personal. The burdens of just the grind, and those opportunities afford people not only validation, I'm not alone, that there are a lot of people that are at risk of burnout, but then you can hear other ideas from folks about what they're doing to be better stewards of their own health care, their own mitigating their own burnout. And it's a real cool, safe, supportive environment, and that's now baked into organizationally something that Ridgeview's done, which I think is really important.
Yeah, absolutely. And I've seen a lot about that, like the de-stress, the debrief thing that she offers, and I think that's really, she also offers it very frequently. I don't remember exactly how often, but it's very often. I constantly see messages about it coming up, and I think that's a really important thing to have across the organization. And you brought it up, but I was going to ask you, how are these healthcare organizations addressing this problem, as in supporting their employees, so that, because if someone's feeling burnout, it also affects the quality of care that they can provide with clients, patients, in whatever setting.
No, that you're right. I think, my sense is that, and healthcare is not alone in this, but in a lot of industries, there's been a huge paradigm shift in the way people try to accommodate the needs of their employees to stave off and mitigate burnout. So it may mean looking at non-traditional work hours. It may mean flexibility in work location, virtual versus in person, changes in how packages with leave are put together, rethinking how time off looks. You know, some organizations have lump personal time and sick time all together. Some have sick time and vacation time. So I think that in and of itself, you know, the flexibility in packaging how work is done has been one organizational change. The hardship, though, are for the 24/7 delivery of healthcare. A lot of those folks don't have some of those same flexibilities. There has to be someone on site, whether that's supervised residential, our inpatient unit, our mobile crisis staff, and others. So, you know, it's challenging healthcare, I think, to think through and pay witness to how to better help and support the staff, because without the staff you can't deliver the service. And if there's a shortage of staff already, workforce, it needs to be a top initiative of most agencies now. And at Ridgeview it is. Staff, recruitment and retention, and communication and engagement. Those are top initiatives organizationally. So that then gets baked through it's not just a top, board-driven initiative. It becomes, well, how are we managing that at an operations management level? Then how is that being nested within supervision of programs and teams? What other organizational changes can be leveraged to mitigate burnout? So that may mean more opportunities to do fun things. Remember that joy is supposed to be part of what we do. It's also been interesting, having attended a meeting on the inpatient unit yesterday, hearing stories of people's lives not just being changed, but saved. So remembering and hearing the difference that we make can actually help mitigate burnout, because otherwise you get caught in that trap of it's production without really honoring, all this production is actually having a tangible, beneficial change in people's lives, which is really important.
Yeah.
I've been rambling, so I don't
No, you brought up a lot of really good points. I liked what you said there at the end, especially about like remembering why we're doing what we're doing. Because a lot of times, not specific to Ridgeview necessarily, clients may get transferred to another place, another healthcare system, and some roles naturally may not see the conclusion of the work that they're doing.
Yeah.
Or at least not in a way that feels fulfilling.
Right.
So, and I've seen Ridgeview do this multiple times with different groups and different programs where they talk about the successes. And I think that's really important, because I remember like you were on that meeting, the one I'm thinking of specifically, it was a few weeks ago, I believe. But you were on that meeting. I think it was like the Stop Miss program, and like all of leadership was on that meeting, and talking about the successes. And I thought that was really important, because I could just kind of tell when I was seeing that meeting that people were happy about that. You saw smiles on employees' faces, and it can be things that may be seemingly that small.
Yeah. A colleague of mine, Ann Pirtle, several years ago, she was sharing a story and she said something like, it's good to hear good things. She just sort of just said it like that. But when she said it, for some reason, it locked into my head. This is an important, simple concept. It's good to hear good things. So I wrote an opinion about it, and because it meant that much. And yesterday, long day, not everything went according to plan. I was tired. Before leaving, I went to check email, and there was an email from a colleague who it was to me, Amy Olson, regarding a client that was taken to or referred to our Fentress outpatient clinic from another provider who said, if you guys, were to help this person, they're an hour away. I've referred this youth, so it's someone under 18, to your clinic to get connected to care. And she, the client, commented afterward that she was uplifted and just emanating positivity because she felt it was such a warm, welcoming experience with that clinic, with those staff. She couldn't wait to go back next week for her follow-up appointment. And our colleague just wanted to pass that along. Hey, just want to let you know what happened to my client today. And this is from the other provider. So it was her telling that story. And it just totally shifted the way I finished that day yesterday. It was like, so I said, it's good to hear good things. And if we can be mindful enough when we see good things or hear good things happening and recognize it and share it, it can really help everybody.
Yeah.
It lifts everybody up. Like, okay, yeah, we're all still rowing in the right direction. The work is hard, but I'm not in it alone, and we're making a difference.
Yeah, absolutely. I did have another question for you. I want to pick your brain about it. So what do you recommend that healthcare workers do, whether it's, in a hospital setting, at clinics, or, somewhere like Ridgeview? What do you recommend that healthcare workers do to protect themselves and mitigate burnout?
Yeah,
I know that's a loaded question. That's a tough one.
We may have
Not simple.
We may have to pick this up next time.
A part two.
Right, part two. Next semester after you get a little break. It is I say this all the time, and I'm not sure where the quote came from, but it's another one of those things. When I heard it, it sort of locked in, like, this is important. Schedule is how our intentions are made manifest in the world. So my intention may be, I want to manage my burnout, or I want to mitigate burnout. That may be my intention. But just wanting that to happen doesn't really happen unless I schedule things to make it happen. And you may say, schedule? Well, that now I'm feeling burned out by a schedule. But the example that I give is I came across these 5 little activities that really resonated with me. It was at the beginning of the pandemic. I cut them out and I put them on my cork board right above my monitor to the left. And I look at those every day, and they're very simple things. Be active, keep learning, give, be curious, and there is a 5th one, but I'm not going to stress about remembering that right now because it's on my cork board. But those things are just, they're examples of what you can do. And when I look at those, it's not rocket science. It's not, I'm not doing anything magical. One of the active things is, man, you've been sitting at this desk for 2 hours. Get up and walk around the building. Go outside. Yeah. And it's like, okay, that's a simple thing. I can do that. The schedule is that it's there. I see it every day. It's a constant reminder that I need to be a good steward of my own well-being. Because if I don't do that, I can't do it for anyone else. It's also, I think, recognizing, having the courage to look in the mirror and, this stigma associated with, are you strong enough? Are you tough enough for this hard work? No, I'm not. I'm not. I need to take breaks from time to time. It's emotionally draining work. It's mentally draining work. It tugs and pulls on lots of different fibers of your being, head, heart, soul, and just knowing that you cannot be Superman or Superwoman in this field is an okay thing to recognize.
Yeah.
Did I? I don't know, I have no idea if I answered your question.
No, you absolutely did. Right. I think, especially with the example of like the stuff on your cork board, like keep it simple.
Yeah.
I mean, you don't have to do anything like super crazy to do something that fulfills you.
Yeah.
It can be completely separate from your work, what you're doing at a professional level. Keep it simple and talk about it.
Yeah.
Don't bottle that up because that never works out the way you might hope it will.
No. Connect. That was the other one.
Oh,
Connect.
The fifth one was connect?
Yes. Which is exactly what we're doing.
Yes.
And the fact that it like totally skipped off, so yeah.
Yeah, that when you were having trouble remembering the fifth one, I was just going to be like, it should be like talk about it, like communicate, like that's what it should be. But I think that's all I have for you today because I mean this is a conversation that's just like we could go on forever. Yeah. No, so thank you for talking with me today about this, and thank you for joining us, and happy holidays.